Welcome to Jam with Ram, a show by radiologists for radiologists, where radiologists get to pick each other's brains and share their thoughts, ideas, and mantras. We're very privileged to have with us Dr. Parveen Gulati, all the way from Delhi. He is the director of Dr. Gulati Imaging Institute. He's a technical committee member of NABH QCI. Welcome, Dr. Gulati, to our show. So how has your stay been here in Hyderabad?
Oh, that's wonderful. Hyderabad is, I think, a very clean city, one of the cleanest cities in India I've seen.
All right.
I think that's one thing, maybe better than Delhi.
Okay. Yeah. Did you know Hyderabad is known for its biryani? Have you been indulging in their culinary delights?
It's not my first trip. I have been to Hyderabad a number of times.
Oh, great.
And I've seen Hyderabad changing, you know, when I came for the first time, maybe about 10, 15 years back.
Oh, right.
And now Hyderabad is a totally changed city.
Yes, yes.
It's nice to see Hyderabad growing, India growing.
Yes. And how has the conference been so far? Have you been able to interact with a lot of fellow radiologists?
I think it's a well-organized conference, except one thing I can say, what I found from a lot of people was they were finding it difficult to connect the two separate places.
Yes.
Right. In fact, maybe some of them, that's one cause of concern which people found. Otherwise, I think it's a very well organized. Scientific stuff is good. Trade is good. I think last time we had it in Delhi. Delhi, we had a lot of good words about Delhi conference, and same thing can be said about Hyderabad. But I will say that trade here is better than what it was in Delhi.
Okay, that's one. All right. So, doctor, you're known as a mentor in an MRI, and apparently you know the good, bad, ugly of the Philips NRI scanner. So, would you like to share some of?
Yeah, it's by chance that we become mentors because we were born in that age. I joined radiology. That time we got the first whole body CT at GV Pant Hospital. That was a Tomo Scan 350, and I remember that time in Delhi that GV Pant, because we had that CT, it used to be known as the Boston of Delhi. So, but it was just a chance that I was born in that period, and we joined radiology at that time.
I'm sure Dr. Ram would like to add
Absolutely. Something. I mean, when I started my career in 1989, one name used to I used to hear, Dr. Parveen Gulati.
Oh, thank you.
People used to say that there are few people who are hands-on radiologists in this country. And I always wanted to be a hands-on guy, and I'm trying. And Dr. Parveen was from the day one, he's on hands-on.
And now Dr. Ramon, I think, has surpassed everybody. He's probably the best sitting on the MRs and playing with the MRs and the new sequences. Yes.
Good enough to do this Jam with Ram show. So, yeah, I mean, definitely he is.
No, we would also Jam with Ram show in future. We would like to have face-off sessions where we will sit in front of the gadget and we will play on the fly.
Yeah.
We would love to do that and also pick the brains of the industry.
I'll be using his words only, that will try to be the mentors, dementors and tormentors for
Absolutely. Because it is very important to do intraspectroscopy, and a particular interface you are finding it good because of your convenience. It may not be the ideal. There is nothing called ideal MRI or something, ideal device or something, ideal protocol or something. Because you will fall in love with somebody and get married to somebody else. That is a true story. Because I fell in love with all the Hollywood actresses. But for me, they were ideal. But I got married to somebody else. I mean, I think at the end of the day, you have to wait for the best.
Yeah, that's what is important. Before getting married, you have to see, you have to judge.
Exactly.
And that's what is true for MR also.
Exactly.
Before falling in love with something, you must know the pros and cons for that sequence or for that whatever you are using. So that's very important, that we must judge before we start using it, before we start getting before start hyping it.
Yes.
That's very important, and that's practically our role as senior has to be for the youngsters.
And because
as a mentor, so what would you like to say for these young radiologists?
Again, I will repeat that what is important, especially when we talk about MR, is this younger generation. They don't want to sit on consoles. Their basic aim is just to report, and maybe they want to make fast money or whatever. What I have seen amongst the juniors is they don't want to sit on the console, they don't want to play with the sequences. What I want, they should be motivated to know MR as a totality. They should take MR not only as a clinical part, because what is important is the basics of MR. Till they are good in the basics, till they know how an image is being formed, till they know how they can change the image by changing the parameters.
But where do they go to know and
That's,
learn.
I think, our
and-
responsibility. Persons like Dr. Ramon, he is probably one of the few in our country who knows who has a deep knowledge about the basics of MR. Even amongst the seniors, you see most of them, they are more concerned with the clinical aspect.
Yes.
No, actually, to answer your question, Praveen,
No, because there are radiologists, youngsters in the villages. So, you know, how do they contact and how do they learn?
youngsters, the doctors now are missing in the villages. That is the main problem.
Yes.
So,
And why
so-
is that? You know,
Yeah,
isn't
no,
it
there
because
is a
there is
definite, there's definite heterogeneity at the bottom of the pyramid. That's where a lot of rural health schemes are going to target that. But coming to our point that younger generation is a little impatient, they're not monitoring the cases. In the past, we used to monitor a case. That is, we used to take history of the patient. Then once you put him on the gadget, on the fly, take advice from the clinician and take advice from the senior mentor of your department, and then say, okay, sir, should I do this protocol, that protocol, and proper protocoling before sending of the patient. We used to show the wet film.
Okay.
So then the senior used to see the wet film and say, okay, now you can dispatch the patient back home. So now youngsters are not doing those. They're also not passionate to know the interface of the system. So, so what is happening is they are at a wrong time, they are doing wrong thing. See, for us, we are still energetic, still we get that same kick in the stomach when we look at an interface and we are asked to play with a toy. That is because when we were young, we felt that it is a great privilege to work on MRI. It's a God's given privilege that you are working on such a great toy, which can unfathom and which can unveil the secrets of the brain and body. So that was a real kick in the stomach. And even now, as it is evolving every day, new technologies are coming, new sequences are coming. We always remember that the bread and butter sequences of MRI or the roti non-sequences of MRI are the ones where you augment an image beautifully. You present a surgeon-friendly image, where surgeon immediately gets a wow, lovely image, Dr. Ram, or lovely image, Dr. Praveen. Our day is made because he is the end user of the program. From these images, he has to turn his head and back to the flesh and blood on the table, the reality. So the gap between surgeon and the radiologist, it is closing because of the 3D sequences, new special effects on the workstations, and 3D programming.
Right.
So we want the youngsters, they should take up these new techniques.
Okay.
And as
See,
Dr.
that's
Yeah.
very important. What he emphasized, and I will re-emphasize, that the clinical profile of we must realize that we are the doctors.
Yes.
We are not simple radiographers. And it makes hell of a difference. We can give you a number of examples where if we had not taken the clinical profile into account, we would have missed the diagnosis.
Yeah.
So it's very important to emphasize with these students that behave like doctors, talk to the patient, talk to the clinicians. Interaction with the clinicians is very, very important. Then we must try hard to find out the feedbacks,
Yeah.
where we have gone wrong. Till we know our mistakes, sitting in a room, okay, what I have written is final. That should not be the attitude. We should try to find out what I had written, was it really true? Where have I gone wrong? How can I improve upon it?
Alright.
Retrospectively also, can we do the things correctly? So those are the things these youngsters have to be taught, and I think that's where the role of all of us comes.
And as a director of your institute, this is what you would.
See, in our institute, we are about 5-6 radiologists. We see to it, if not 100%, at least 90% of the cases are discussed by 2 to 3 radiologists.
All right.
And we see to it in our center, in our institute, not a single patient is done, whether CT or MR or any imaging, till a doctor is present. We never leave our center only on technologists. This is one thing which can be checked right from the morning till the evening.
Okay.
That's my practice, and it pays me.
Definitely.
There are a number of situations where it has helped me. And we have good interactions. We attend conferences. We our youngsters also, we motivate them to go to conferences, and that helps. And I think that's what, whether you are in a government setup or in a private setup, that should be the
Definitely,
yeah.
yes.
And
Dr. Ram.
regarding this, about 5 guys from different parts of India, Parveen Gulati, Dr. Radesh, Dr. Nani Wadekar, and Sanjeev Handik, and myself, we come together for a common goal of starting a good educational, content-oriented, and also orthodox, unorthodox way of transmitting the energy and also knowledge in the form of a new concept, which the first conference will be conducted in May.
Okay.
Sometime in the May. Okay, with all our new buzzwords going around us, Cobra and all these things, we have a lot of words to choose on which concept and platform this will be taken care.
Yes.
We want to use all the tools. We want to be more oriented in practical hands-on and take-home messages. And we also want to unveil new speakers, unsung heroes, who don't get opportunities to showcase their work.
Right, okay.
And we will really go with all the testosterone, adrenaline what we have.
Great, yeah, that sounds promising. Something to
It will
look
be
forward
totally,
to.
it will be unbiased
Yes.
forum. We'll take only people with talents. We'll try to promote talent, and we'll definitely would like to highlight the youngsters who have talent.
And we'll be talking to Dr. Parveen more frequently in the Jam with Ram sessions.
All right.
And he, in front of YouTube now, he will promise us that he will share with us 10 skills
Okay.
a radiologist should practice in MR. We will discuss what skills they are, because they totally, somebody calculated there are 60 skills a radiologist should have to practice. And I said, how did you come out with the number 60?
Yeah.
He said, how many handicrafts, how many fine arts are there? I said, 64. Okay, make it 64. I said, why did you come with the number 60? He said, if you look at from different levels of patient interviewing, safety management, every layer has a skill. So if all the skills, if somebody masters, then the governing body can call him as a MR master or expert.
Okay.
So we want to manufacture such kind of guys under the umbrella and promote such guys under the umbrella of our common concept.
All right.
And thank you very much,
Sounds
Dr.
fun. Yes, thank you so much, Doctor, for spending time and enlightening us. It was
Thank
a
you so
pleasure
much.
having
It
you
was
with
nice to
us.
be here.
Thank you.